Hello everyone, I came with a new video. The topic is subinvolution. Myself, Gideani Thomas, working as a tutor in Triplum College of Nursing. What are the objectives of this video? At the end of the class, you have to know the definition of subinvolution, enumerate the causes and aggravating factors of subinvolution, enlist the signs and symptoms, discuss the management of subinvolution, describe the preventive measures and prognosis of subinvolution. These are the objectives of this topic. The definition of subinvolution. Subinvolution is a medical condition in which after childbirth the uterus does not return to its normal size, or when the involution is impaired or retarded, it is called as subinvolution. This is according to D.C. Datta. So, after the delivery, the uterus will return to its normal size. That is called as involution. If there is some retarded or impaired, then it is called as subinvolution. In this picture, you can see that there is retained placenta and uterine atony and subinvolution happened. What are the causes of subinvolution? There are many causes for subinvolution. Grand multiparity, that means more than 6 childbirth. Overdistension of uterus as in twins and hydromnias. So in twins and polyhydramnia, there is a overdistension of the uterus. Maternal ill health, if the mother is having any critical medical condition, or the cesarean section. After the cesarean section, sometimes subinvolution will happen. Then prolapse of the uterus, retroversion and uterine fibroid. In this picture, you can see that there is a first one is a normal uterus and then second one is a prolapse uterus. It's visible at the vaginal entrance. You can see that there is prolapse of the uterus and twin pregnancies and picture of the uterine fibroid and polyhydramnias. These are some of the conditions it will cause subinvolution. What are the aggravating factors for subinvolution? First one is uterine sepsis. That is, if there is any infection in the endometrium of the uterus, it will aggravate the subinvolution. And retained product of conception. After the delivery, you have to ensure that all the conceptual product it will remove from the uterus. Otherwise, it will aggravate subinvolution. What are the symptoms of this? Sometimes it is asymptomatic and sometimes the symptoms are abnormal local discharge. It is excessive or prolonged, irregular at times, excessive uterine bleeding, irregular cramp-like pain. Because of the retained product, the mother feel cramp-like pain. Rise of temperature in case of sepsis. The mother is having any infection, the temperature will rise. These are some of the symptoms. And what are the signs? While looking at the abdomen, you can see that the fundal height it is greater than the postnatal day and displaced bladder or lower rectum and uterine feels boggy and softer. These are the signs of subinvolution. What are the diagnoses of subinvolution? The mother may feel bearing down sensation, okay, and she may have acute lower abdominal pain. And then varying degrees of shock. While doing the abdominal examination, we can see that the cupping or dimpling of the fundal surface. These are some of the diagnoses. What are the complications? First one is shock, hemorrhage, pulmonary embolism, uterine sloughing, uterine infection. Because of the signs and symptoms, it will lead to the complication because of subinvolution. Next is the management. The management, we have to see that after the delivery, all the retained product, it should be came out from the uterus. And if there is any retroversion or prolapse of the uterus, the pessary you can apply. And for enhancing the involution process, injection methargin to be given. If there is any infection, antibiotic can start. In the period of postpartum, we will encourage the mother for early ambulation and daily evaluation of fundal height to document the involution. When we are doing the fundal height, every day we have to see that it should be reduced. For hydrostatic correction, we will flush the saline solution into the vagina. So the water pressure, it will inflate the uterus, and when it probes back, it will come into the normal position. And sometimes we will do manual reinsertion of uterus under general anesthesia. If all these attempts fail, they will move to the abdominal surgery to reposition the uterus. The medical treatment for subinvolution, we have to administer oxytocin to improve the uterine muscle tone. The oxytocin medication, it is methargin, pitocin, ergotrate, malate. In that, methargin, that is one of the drug of choice because it can given by mouth also. Dilatation and curettage to remove any placental fragments, and antimicrobial therapy for endometritis. For the emergency management, emergency hysterectomy, that is a surgical removal of the uterus. In an extreme cases, after the hysterectomy, we have to closely monitor the patient in an intensive care unit for few days. The prognosis are infection, sloughing of the uterus, and chronic inversion of the uterus. What are the preventive measures for subinvolution? Do not employ any method to expel the placenta out when the uterus is relaxed. So the third stage is very important here. Then avulsion of umbilical cord is to be avoided, and we have to do the manual removal only in a proper manner. Otherwise, the subinvolution will happen to the mother. And concluding the topic, subinvolution, it is the incomplete return of the uterus to its pre-pregnant size and shape. With the subinvolution, at 4 or 6 weeks of postpartum period, the uterus is still enlarged and soft, and oxytocin is prescribed to enhance the involution process. So till now we've seen the definition of subinvolution, causes, aggravating factors, signs and symptoms, diagnosis, management, prevention, and prognosis. This is all about the subinvolution. These are the bibliography for this topic. Thank you so much for listening the video.